Is it true that you've run over 30 marathons?
That is correct, 34, and I'll be running number 35 this weekend, the Manchester City Marathon.
Oh my God. Okay, that's a lot of marathons. So my first question is why? Why do you run marathons?
I am in the Army, and many years ago, I came back from on deployment with a number of other individuals, and we thought it would be a great idea to run the Boston Marathon with full fatigues and rucksack.
Really?
And combat boots. We thought it was a great idea. So we did it. We lined up and we finished the race. After we were done, we all agreed that it wasn't a great idea. And then I said to myself, it might just be easier to do this race without all of this stuff. So why don't I try it next year with just sneakers and some shorts? Let's see how that goes. And it was indeed a lot easier.
Was it a lot? Did you go faster without all the stuff on?
Oh yeah, a lot faster.
You're listening to New Hampshire Has Issues, and I am your host, Liz Canada. Today is Veterans Day, and I wanted to put together a show that is specific to what veterans are facing in New Hampshire. And not just New Hampshire, but across the country. But my whole podcast is about New Hampshire, so we focus on what's happening here. And I talked to Henry Och, and we talk about what has been working in terms of making sure that veterans have housing in the state, and some gaps that still exist. There are still issues out there, of course, and he talks a bit about the issues around healthcare, and that if community health centers close, that doesn't just impact veterans, that impacts everybody. One content warning in the episode is that around minute 30, Henry starts to talk about someone he knows from the work that he does, and his name is Michael. There is talk of suicidal ideation, so if you need to skip over that for your well-being, please do. Always take care of yourself. And just a general reminder that if you know someone who's experiencing a mental health crisis or needs support, you can call or text 988 for free, confidential, 24/7 help. If this is the first episode of the New Hampshire Has Issues podcast you're listening to, welcome, and I'm so glad you're here. Henry and I reference a previous episode, and that title is Homelessness in New Hampshire with Erica Diamond and Lauren Bombardier. That link is also in the show notes. That'll take you right to that episode because homelessness is a very big issue in New Hampshire. And this episode today focuses on veterans. But as I learned in that episode with Erica and Lauren, it is a very significant issue overall in our state. So if you're looking for a follow-up episode, or if you want to pause this one and go back and listen to that one, whatever, you can choose your own adventure always. If you would like to support the show, you could become a monthly supporter at patreon.com/NHHasIssues. If you have an idea for an upcoming episode, you can email me, newhampshirehasissues@gmail.com. This episode is generously sponsored by Seacoast Soils, which is an organic compost and topsoil provider for New Hampshire, Maine, and Northeast Massachusetts. I know it is not quite the season to start thinking about this, but I promise you, even though it is getting dark at what feels like 2 p.m., the spring will be here at some point. Okay, that's enough for me at the top. Thank you for listening, and I will pass it back over to me. So, welcome to New Hampshire Has Issues, the podcast that dares to ask, are we doing enough for our veterans in New Hampshire? I think that's the core question that I'm coming to this conversation with. And joining me today is the President and Chief Executive Officer of Harbor Care, Henry Och. Henry, welcome to the show. Thank you for being here.
Thank you for having me.
I'm so happy to talk to you about the work that you all are doing because veteran support is near and dear to our family's heart and lives because there is a very close family member who is a veteran and, very important to care for those who have served. So I'm really glad that you're here. Thank you so much for being here.
Absolutely.
I'm hoping we can start with you telling me a little bit about the work that Harbor Care does in New Hampshire.
Sure. So Harbor Care has been around for well over 40 years. It was established in the early 1980s. And the original goal of the organization was to provide housing to individuals with severe mental illness. And over the course of the follow-on decades, it grew quite a bit and it provided a lot more services to not only the greater Nashville community where it was originally founded, but really across the state of New Hampshire. So fast forward to today, we have 3 distinct service lines. The first of which is housing. We provide housing and housing supports to over 1,000 households across the state of New Hampshire. We have our healthcare service line that really focuses on providing healthcare for those individuals experiencing homelessness. And we have primary care, behavioral health, addiction treatment, and dental services. And we have a very robust set of programs for homeless military veterans. And through that service line, we provide transitional housing, permanent housing, suicide prevention, job training, and other preventive services. And we touch the lives of approximately 500 veterans a year through those programs.
That's incredible. And how long have you been there?
I've been with the organization since February of 2020.
Nice. So the work is with veterans and so forth, but also expanded to other folks who are not veterans, or is this specifically for veteran support?
So the common thread across our many programs is that we're an agency working on breaking the cycle of homelessness. And one of the special populations that we serve are homeless veterans. But through our other programs, we help other individuals that are in need across the state of New Hampshire.
Yeah, that's great. So speaking of the topic of homelessness, I had Lauren and Erica on from Families in Transition. They were previous guests. We had a sort of an introduction episode to the issue of homelessness in New Hampshire. And they shared that overall, New Hampshire is doing pretty well comparatively when it comes to supporting veterans, maybe specifically for housing. How is it looking from your vantage point of working with folks? Would you say that New Hampshire is doing pretty well? Do you think there are areas for improvement?
Well, talking about the issue of veteran homelessness from a national level, the VA really has worked pretty hard on working on this issue over a span of well over 10 years. The population of homeless veterans across the country really has gone down quite a bit. And I'll talk about the reasons why in a little bit. But here in New Hampshire, as of last week, we have a total of 136 homeless veterans in various states of homelessness. Some of them can be completely unsheltered, living in the woods or somewhere in one of our cities. They can be living in a shelter, like the Families in Transition shelter in Manchester.
Yep.
Or they can be in transitional housing, which is a program that we operate alongside with another agency called Liberty House in Manchester. So 136 veterans statewide. We're really focusing right now our efforts within the city of Manchester, where we have 32 veterans that we're working with the hopes of transitioning them from either an unsheltered status, a shelter status, or living in transitional housing, really getting them the supports that they need to move on to permanent independent housing in and around Manchester and across New Hampshire.
How do you know that there are 136 individuals across the state? Erica and Lauren told me a little bit about like the different service providers who are connected and, the point in time count. But like for this sort of not narrower population, but for like this very specific population, how do you know that there are 136 individuals?
That's a great question. So that is one of the things that really makes New Hampshire special, and that is that the community agencies that are working on this issue have open lines of communication with each other. So within the state of New Hampshire, we have something called the by name list, and as the name alludes to, it is a list of every single veteran in the state that has been identified as being homeless. And we entered data into the centralized system, which is managed by the state. And every day, every week, we go into that system to determine where the veteran is, what are the needs that have been identified, and what are the gaps that need to be addressed.
Wow.
And that focused and coordinated effort really has led to some amazing achievements, specifically in the city of Manchester, where in partnership with Mayor Rue, in September of last year, we set out an initiative to effectively end veteran homelessness in the city. And since that announcement, we've been able to house nearly 70 previously homeless veterans into permanent housing. So it's really a testament to working towards a common goal and getting the buy-in from many stakeholders.
So That sounds like a really excellent system to be able to say, here are all the individuals, let's do the outreach and find those folks and work with them. What are the challenges that you face or the challenges that New Hampshire veterans themselves are facing right now? What do they face in 2025?
Well, a lot of the challenges that this population encounters are very similar to what the general homeless population encounters. Access to primary care, behavioral health, and addiction treatment certainly is one set of needs that we have a shortage of resources to meet. You probably heard from my colleagues at FIT that the available housing is also a significant challenge.
Yeah.
And then you have the broader economic situation that's happening not only in the state but across the country, and that is that the cost of living is going up. And one of the things that I try to really educate people on is that the path to homelessness it varies from person to person. There is this archetype of the homeless or your typical homeless person, and usually the tags of addiction and mental illness are associated with that. But that's not really what we see. I'll tell you a quick story of an individual. I was out on an encampment walk with our teams up in Manchester, and we came across an older couple, Air Force veteran, who was living up in the North Country, and their landlord increased their rent to a level that they just couldn't afford. They lived on a fixed income,
right?
And almost overnight they were homeless. So they came down to Manchester to look for resources, which they were not able to find until they came across our teams. So we have seen instances of individuals who were just simply priced out of their home. They did everything right. But the economics around them just worked against them.
How are folks like in the North Country? You find your rent is increasing dramatically. What's the sort of lag time between they're in that position and they find you or they find another service provider? Like, how much time between I'm essentially losing my housing because of the price and I have, direct support?
So I will say that building shelters, building transitional housing facilities, they're great initiatives, and we have a number of them, but they're very expensive. They're very expensive to operate. They're very expensive to staff. And by the time that we interact with individuals in need and we place them into transitional housing, a lot of things have happened. So really, the best solution is the solution that is identified the farthest upstream as possible. The best and probably the most inexpensive solution as well. So prevention is really is the space that we want to operate out of. So we do have many programs that support individuals who perhaps are falling behind on their rents because their rents have increased, or have an unexpected medical expense, or maybe they lost their job or their hours were reduced. So for military veterans, we can come in and provide those temporary supports to help them bridge to get to a different place, and we can help them identify solutions before they get to a point where they do fall into homelessness. Now, the challenge that we have is that we have a lot of great programs for military veterans, but they just don't know about them. And there's another element that's within the military culture that, for example, me as a soldier, I see a problem in front of me, I'm going to try to figure it out. And wearing the uniform, you're proud to do so. And sometimes asking for help gets very hard. So we do see that. And unfortunately, when it does get to the point where individuals are asking for help, they're further downstream, and more resources are required to address the issue at that point.
Yeah, that's really helpful to hear that, of course, prevention is critical. There are resources at times to help folks pay for their housing as needed, because it is less expensive to help them remain in their homes than have to help them find new housing or paying for hotel rooms, those types of, which are all important, but there's that cost becomes a little bit higher the further into those services that you need to help provide. What are some of the barriers that lead veterans into homelessness or housing insecurity, whether in New Hampshire or beyond? You mentioned earlier that it's pretty similar to what other folks experience. Are there any unique elements to being a veteran in that way?
For a military veteran, their situation can certainly vary greatly. So, for example, if an individual, let's say, gets discharged from active duty, goes back to their community, their support network might not be there. When you're on active duty, your support network is within arm's reach, as well as a number of different resources. We have certainly seen situations where individuals leave their last assignment. Now they're back here in New Hampshire, and they're lost, and they might be struggling with some things that perhaps weren't that big of an issue when they were in uniform, but now when they're here, they have to cope in different ways. Some of them perhaps not very healthy ways. So that's certainly something that is unique. The stress of being in a combat situation, getting exposed to situations that might lead to post-traumatic stress is also something that I think is perhaps not necessarily unique to military veterans, but it's certainly amplified given the situations that they're in.
I have a maybe too honest of a question to ask in that regard, which is what happens for folks who've served in the military? They leave active duty in that capacity. What supports do they have for their mental health care? Like when thinking about PTSD or other elements, like how hands-on is our military making sure that they're getting the care that they need in that way?
The VA has had a lot of success over the course of the past many years in really enhancing their service delivery model. I have had the opportunity to visit the VA Medical Center in Manchester, the VA Medical Center in Bedford, Massachusetts, and I do have to say that the level of care and compassion that those teams specifically have demonstrated to the veterans under their care really is what the veterans deserve. Are they perfect? No, but I really do think that there's a genuine desire to do better and improve.
I think about my former students who served in the military and the types of resources they had when they returned from Afghanistan or wherever they were serving. And I was just curious sort of what that looks like. Is it like, okay, we want to make sure that you're connected with this provider, with the VA, we're going to set you up with appointments. I genuinely don't know like how that looks for folks when they come back to civilian life, essentially.
Yeah, I think there's a little bit of, unfortunately, stigma associated with seeking help. Once you're when you're in the culture, and then when you exit out, it's just an artifact of being in the military. Whether it's good or bad, it's there.
You talked a little bit about the progress that has happened in Manchester and across the state. What still needs to change to reduce veteran homelessness in New Hampshire?
Well, affordable housing is something that I'm sure you heard quite a bit when speaking with our partners over at Families in Transition.
And not just from them, but from many other episode guests for other topics.
Yeah.
Affordable housing comes up a lot. Yeah.
So I think the state has certainly taken on many discussions looking at potential innovative solutions, additional dwelling units, ADUs within private property is something that is part of the solution. Having exploring the concept of tiny homes is also something that has come up. Exploring more shared living options, like a single room occupancy facilities with maybe shared kitchens and dining rooms. That's also come up. We actually operate a couple of those facilities, not for veterans, but for other folks. And really, one of the things that is probably a longer term solution is working with property developers in advocating for building affordable affordable units within their broader projects. Now, at the end of the day, these folks I understandably need to make a profit, and perhaps these affordable units might not necessarily help that effort, but perhaps advocating a mixed use type of solution for these development projects. So we're having all of those conversations, and every time that we engage with property developers, we talk to them about the issue within the state of New Hampshire. I mean, 136 veterans as of last week. That number is not insurmountable. It's very possible to get to a point where we've effectively ended veteran homelessness in the state. Now, that doesn't mean that there'll never be another homeless veteran, but what that means is that we have built systems that are fast-acting, responsive, resilient to identify a veteran in need and get them into appropriate housing solution.
How do we compare to our neighboring states like Maine, Vermont? They're both pretty rural, similar to New Hampshire. When it comes to the supports and, being able to identify how many folks are out there who need housing, how do we compare to them? Although I know people in New Hampshire both love and hate comparing ourselves to other states, so I dare venture into that topic. But I'm just curious, similar sort of demographics. What does it look like comparatively?
So I have to say that beginning at the top, during Governor Kelly Ayotte's inaugural address, she said that she was going to work with her administration to make New Hampshire the most veteran-friendly state in the country. And through her efforts and the efforts of many state agencies, they're really demonstrating that. We're seeing that in action. Now, it's going to take a lot more time and energy to reach the goal of effectively ending veteran homelessness across the state. But looking at other states across the country, the issue is larger, more complex. There are many agencies within each respective state that are there to do good. But I think here in New Hampshire, one of the things that I have seen that really sets us apart from others is being able to effectively collaborate up and down the state. So, for example, we've had this effort in Manchester, which I've talked a lot about. We also have a concerted effort over in the Keene area, as well as Concord. We have effectively ended veteran homelessness in the city of Nashua. We did that in 2017. So we know it's possible, and I'm confident that over time we'll achieve that goal across the state.
I know we're in a federal government shutdown right now. As of us recording on November 4th, we're still in a shutdown. What does it look like from the federal level as well in terms of ending veteran homelessness in New Hampshire?
The VA has been a really great partner in that space. Specifically, the VA Medical Center out of Manchester and the VA out of White River Junction, Vermont. The White River Junction provides support to parts of the northern western part of the state. So they've been great to work with. Our transitional housing program for homeless veterans, we have 3 facilities, total of 70 beds. That is a program that we operate in partnership with the VA, and that's been a very significant success. We also have a homeless veterans reintegration program where we provide job training to previously homeless veterans. We connect them with veteran-friendly employers. If they don't have clothes for an interview or to go to work, we take care of that. We help them with their resume and really do a lot of job coaching. And we support about 125 veterans through that program.
Wow!
And that's through the Department of Labor on the federal side.
So moving not so far from housing, because I think it's very much connected to healthcare, and you mentioned employment support as well. What kinds of healthcare and mental health care services do veterans access in New Hampshire? I know you mentioned the VA. I guess I'm also curious, like what barriers you've seen as you've worked with individuals through your organization.
Yep. One of the challenges that we have when we're working with newly identified homeless veterans is verifying their benefits. If you have been living in an encampment or just unsheltered in general for a while, you might not necessarily have your documents in
Mm.
order.
Mm-hmm.
There's this form that we use to help demonstrate veteran status, and it's the technical term is a DD 214 form. It
Mm-hmm.
pretty much lists out the veteran's information, their discharge status, as well as other information.
Mm-hmm.
But I know I don't carry that around
Right.
with me. And if you're unsheltered, it's probably not on top of your list of things to cart around. So that is a barrier. Trying to make sure that we collect all the appropriate documentation to get individuals connected to services. Once that's established, if they are indeed in the North Country, getting them transportation to those services is also something that is a challenge. If they're connected with us, and whether they're in Nashua, Plymouth, or in Manchester, we do have a fleet of vehicles and drivers to help facilitate that. But it still remains a challenge. So we do try to connect individuals to the VA. That's what the VA would like to see. But there are other community supports, whether they are through the 10 federally qualified community health centers across the state,
Mm-hmm.
or the mental health centers. They have programs specifically for veterans. So, but sometimes the limiting factor there is the availability of clinical staff. To provide
Yeah.
services.
And have you encountered issues with sort of the rural healthcare with health centers closing or decreased staff? They're being stretched thin. Have you found that to be an issue over the last however long that might? I feel like it's ongoing, but is that a thing that you've noticed in your work?
So one of the programs that we operate, so again, we provide housing and housing supports, healthcare for the homeless, and programs for homeless military veterans. Our healthcare for the homeless program is what's called a federally qualified community health center, and I believe there's 10 of them across the state of New Hampshire. And those health centers that are up in the in the North Country really have been struggling. For a wide array of different reasons. So ultimately, if we have sites shutting down, they're limiting access to care to not only veterans but just the general population.
Yeah.
So what happens then? People don't get that preventative care, and then ultimately their situation might degrade to a point where they have to go to an emergency room somewhere, which is a lot more expensive intervention than keeping a clinic open up in the North Country.
Goes back to the prevention is the most cost effective. And then as you get further down, it just becomes more expensive for everybody, really, truly.
Yeah.
We touched on this a little bit, but maybe there's room for more. How does trauma and PTSD or substance use show up for folks you work with? I feel like that is sometimes brought to attention when thinking about veterans and what they're facing when they come back to civilian life. Or maybe that's just a misconception that folks have.
No, it's very real. I'll share a story of a veteran that I've gotten to know. His name is Michael. Michael deployed to Afghanistan, I believe it was in 2010, with the New Hampshire Army National Guard. And while he was over in Afghanistan, he was involved in a lot of combat operations. He actually came back with a traumatic brain injury, and when he got back, he didn't really know how to deal with what was going on inside his head. So he self-medicated with drugs and alcohol for 10 years, and ultimately that led to him losing his job, getting disconnected with family. And he wound up in a situation where he was living in his truck with his dog. And then one day he realized that he couldn't even take care of his dog. So he put together a plan to take the dog to the MSPCA to give him up. And after he gave him up, he was going to take his own life.
Wow.
But something told him that day that I'm going to give it one more shot and I'm going to ask for help. And he did. And he got connected to our suicide prevention program. We connected him with the VA. we brought him into transitional housing, and the transformation was nothing less than remarkable. At this point, he is well over a year sober. I think he's going on 2 years now. He applied and got accepted into Keene State last year.
Amazing.
As a 45-year-old freshman, I think.
Perfect. That's a great time to do it. Doesn't matter what age.
Yep.
It's a great time to do it.
Yep. He decided to study psychology to give back to the community. So he just started his second year. And what's really impactful with this story is that this August, with the help of his family, he actually bought a home in Keene.
That's incredible.
Yeah.
Asking for help. It's kind of a big jump that some folks have to take, that it's very vulnerable. People could feel very embarrassed to have to do it, but
yeah,
it sounds like you have a lot of examples of folks when that happens. There are supports there to help them and to get them moving in the right direction. So employment is also a part of being a veteran and coming back to civilian life. I imagine for some it's difficult to navigate, post-military specific work. What does that look like for supporting them? I heard you mention like you help folks with resumes and interviews and so forth.
Yeah.
What does that look like?
Yeah. So I think generally speaking, there's a lot of work that I think employers need to do to help support transitioning veterans, not just homeless veterans. So when you're in uniform, you learn a lot. There are a lot of skills that are acquired. Specifically in the space of leadership, management, just general coordination. And when individuals leave the service and try to acquire civilian jobs, that breadth of knowledge doesn't necessarily translate easily to a civilian work setting. So two things. I think that the Department of Defense has done better in educating service members as they're exiting to get them prepared for the civilian workforce. But I think that civilian employers also need to educate themselves on what does it mean to serve, and what are those skills that these folks are potentially bring into the work setting, and I do see a big gap there.
What should employers know? Like, what would you want them to know and do differently than what happens now?
So I would say that when a veteran applies for a job, if what's on the resume doesn't necessarily mean anything to you, call them in and have a conversation. Present them with a scenario. We have this particular problem. How would you go about dealing with it? And then just see their thought process unfold. And more often than not, I think that those employers will find something impressive about that individual in front of them.
It might look on the resume like a different language when they're having what they've done in their military service, but
yep.
Don't let that be a barrier to chatting with them to get to know more. So to bring it back all to New Hampshire overall, the podcast is called New Hampshire Has Issues. What state-level policy changes when it comes to these areas of homelessness and housing and healthcare and employment? Like, what state-level policy changes would make a difference?
Zoning. I think zoning typically is a barrier when we're looking at setting up facilities to support affordable housing. And a lot of that really is managed at the more local level, at the local zoning boards. And I think that we need to have a focused conversation around what the barriers are within each individual municipality to having some of these programs and facilities getting set up in each respective community.
When I started this podcast, I did not know how much I would be talking about zoning on various episodes, but zoning boards and planning boards, they have come up a lot over many different issues. So zoning being one big one, and I had an episode with Nick Taylor, who talked about affordable housing. He really pitched getting to know your zoning board, getting to know your planning board, maybe serve on those. There are usually openings, go serve on them. All right, so zoning being one. Any other things that could make a difference in New Hampshire?
In regards to housing specifically, we have had. I'll tell you one of the things that we saw as a problem post COVID, and that is that there was a lot of relief funding provided and some controls in place to prevent evictions. Now that was both a blessing and a curse for tenants and landlords, depending on which side of the table you were in. We really have to be looking at, again, going back to something that we've talked about earlier, having an open dialogue around what are some of these upstream solutions that we can identify and put into place. Now, so the problem with that I've seen with having a conversation around some of the far upstream solutions is that you might not see a net result in one election cycle, or maybe two, or maybe three. It might be a whole generation before you see the net impact. And in today's real time 30-second YouTube society, that attention span is just not.
It's short.
It's just not.
We've got very short attention spans. Yeah.
I think that for community agencies like Harbor Care and others, I think it's very important that we understand our role as the voices for those who don't have a voice. So we are very intentional about making sure that the broader community understands that the work that we do is impactful, because at the end of the day, there are real people that are in need, and it's our collective responsibility to come together and figure out what we can do with the resources that we have.
Simple enough. Do what we can to support others.
I do want to talk just a little bit about Harbor Care's 22nd annual Thanksgiving community dinner.
Yes,
it's a fantastic event. We hold it at our 45 High Street location in Nashua, and it's an event where we bring the community together. Individuals looking for a warm meal that day can pop in anytime between 11:30 and 2 o'clock and get a turkey dinner with all the fixings. We're very happy that Alex Ray and the Common Man organization is providing the food. They've provided the food for the past couple of years. They're a great organization to work with, and that's open to local residents, the individuals and families experiencing homelessness, veterans, anyone again that's looking for a warm meal that day. And we usually have our many elected officials actually on the serving line.
I've seen the pictures
food
on your website. We've got a little bit of everybody in those serving lines. It's pretty exciting.
Yeah, it's a very special day.
That's really great. And depending on what's happening in terms of SNAP benefits and folks being able to access food, like these types of dinners and meals are more critical than ever because folks need to be able to eat. And not just on holidays, but literally every single day. I'll have links in the show notes about that event, about Harbor Care in general, and to provide that information for folks so that they know what's out there. Thank you, Henry. Thanks for coming on the podcast and talking with me about this.
Yeah, thank you for having me. It was a very enjoyable conversation, and hopefully we can have some more in the future.
I can promise you I have not run a marathon at that point. It's not going to happen now. It's not going to happen then. So thank you for entertaining my questions about running. I'm not a runner myself, but I support those who do. A friend just ran the New York City Marathon, and now my entire algorithm is all marathoning because I was following her and liking all of her posts. So careful out there on the algorithm.